So today I'm going to be completing a health assessment and recording it and sharing it with my instructor. Do you give me permission to record you and share it with my instructor?
Yes.
Okay. Before the beginning of this video, I have washed my hands. I'm going to begin by doing a mini mental exam. What is your name?
Max.
Where are you?
Home.
And what time is it?
8 o'clock.
Okay. So he is oriented to person, place, and time. Now I'm going to assess his attention span. Take your left finger, put it on your nose. Take your right finger, put it on your ear. Attention span is good. Okay. Now I'm going to test his recent memory. What was the last thing you had to drink?
Water.
And remote memory. What was your first job?
Cashier.
Okay. Now I'm going to test his new learning abilities. I'm going to ask you to repeat 3 words, and I'm going to ask you to remember them later on. 3 words: bus, sky, green.
Bus, sky, green.
Okay. On this piece of paper, I have written something down. I would like you to read it.
Close your eyes.
Now complete the task. Okay. And what were the 3 words I asked you to remember?
Bus, sky, and green.
Okay. What is this?
That's a pen.
And what is this?
A piece of paper.
Okay. Now I am going to begin with the HENT assessment. He is oriented to person, place, and time. I am going to begin by visually inspecting your head for any lesions, hair loss, bumps, masses. I don't see anything. Head is not macro or microcephalic. He is normocephalic. Next, I'm going to be visually inspecting the face for symmetry. Eyes, nose, mouth symmetrical. Any facial drooping of the eyes, cheeks, or mouth would indicate stroke or Bell's palsy. I'm going to be taking a look at his ears, which are symmetrical. I'm going to have you tilt your head back a little bit. I am now looking at the trachea, which is midline, and he doesn't seem to be having any problems breathing. A deviated trachea would indicate possible pneumothorax. Okay. Now I am going to be palpating the head and the skull. Any discomfort?
No.
I don't feel any masses or lumps. I don't see any hair loss. Okay. So now I'm going to be inspecting the ears. Once again, they are symmetric. No signs of ulcers. No lacerations. Do you have any pain?
No.
Okay. So now I am going to be inspecting your eyes. Upon inspection, they are both symmetrical. I am going to pull down the bottom of your eyelids to look for the conjunctiva, which is pink and moist. Redness would indicate possible allergies. I'm going to pull up on your eyelids, look down. Okay, and sclera is white. If they were yellow, indicate possible jaundice or liver issues. I am now looking at the hair on his eyebrows and his eyelashes, which are both equal, no excessive hair growth. Now I'm going to be visually inspecting the nose. Which is symmetrical, no deviation. Tilt your head up. Both are pink, moist, and smooth, no turbulent, both areas are patent, no obstruction. Possible deviation would indicate drug use or sleep apnea. I am now going to be assessing his mouth. His lips are pink and moist. If they were red, cherry red could possibly indicate carbon monoxide poisoning. If they were blue, it could be a sign of hypoxia. Now I'm going to have you open your mouth. I'm going to visually inspect the buccal mucosa, which is the side of the cheeks, which are both pink and moist. And now I'm going to be looking at the teeth for any dental caries, any discolorations, Yellow or brown staining could indicate excessive fluoride intake, caffeine, or smoking. Now, his teeth are white. I'm going to be visually inspecting the oral mucosa, which is pink and moist. No cobblestoning noted. Say ah for me. Uvula is midline and goes up and down. Tonsils do not touch, are not red or inflamed. There is no white streaking, which could indicate possible bacterial or yeast infection. Now stick out your tongue for me. Tongue is pink and moist. Go up and down and side to side. Cranial nerve 12. The submucosal nerve is intact. A red beefy tongue could indicate vitamin B12 deficiency. Now I am going to be taking a look at your thyroid. I'm going to go behind you and palpate where your thyroid is. You should not be able to feel it, but if I were able to feel it, it would feel like butterfly wings. Take a swallow for me. I don't feel it. Now I am going to be auscultating for a bruit, listening for turbulent blood flow and whooshing sounds. No bruit noted. I am now going to do a hearing test. I'm going to place my finger on the tragus of your ear. I'm going to whisper 3 numbers in your ear, and I would like you to repeat them.
2, 4, 6. 3, 6, 9.
And this will test his ability to pick up on different frequencies, which we're both able to do. Now I am going to give you an eye exam. Look at my nose. Equal and reactive to light. I'm going to have you follow my finger. I am looking for accommodation, dilation, and constriction of the pupils. Good. Now I'm going to be testing your peripheral vision. Put your hand on your eye like this. I'm going to be putting my hand next to your ear. As soon as you can see it, let me know.
There.
Now switch eyes. Other hand.
Okay. Right there.
Peripheral vision is good. I am now going to be testing his six visions for cardinal. Okay. Now follow my finger. I'm looking for astagmus, which would be rapid eye movements, which would indicate possible brain injury. And I don't see any of those. So now I am going to palpate the neck. Any pain or discomfort?
No.
Okay. Now I'm going to move on to the respiratory exam. I'm going to be listening for your breath sounds. Looking at him, his breathing pattern is normal. No use of accessory muscles while breathing. Chest is rising and falling equally on both sides. And I would listen for a full inhalation, exhalation in each point. I am also listening for any adventitious breath sounds, which would be a bronchi, rails, crackles, or any wheezing. Breath sounds are clear bilaterally. I am now going to spin you around a little bit. And I am going to be assessing in a ladder-like formation. spin you around. Now I'm going to be listening to his heart sounds. So the aortic valve would be right next to the sternum, between the second and third intercostal space. Now I am listening to the pulmonic valve, tricuspid, and the mitral or the apex of the heart.